Welcome to a new concise approach to internal medicine. My name is Guillermo García. I'm an internal medicine physician, and today I'll answer the following questions. What are the criteria for prediabetes? What is the indication of metformin in prediabetes? And what is the best management in prediabetes? The first question is, what are the prediabetes criteria? Prediabetes is the term used for patients with glucose levels that do not adjust to the criteria for diabetes mellitus but have abnormalities in carbohydrate metabolism. Is the major risk factor for progression to diabetes, and the presence of prediabetes should prompt exhaustive screening for cardiovascular risk factors. The criteria are as follows: a plasma fasting glucose between 100 to 125 milligrams deciliter, or a 2 hours plasma glucose during 75 grams oral glucose tolerance test between 140 to 199 milligrams deciliter, or a glucated hemoglobin between 5.7 to 6.4%. In addition to the above, we must consider the criteria for screening for diabetes or prediabetes in asymptomatic patients. The first one is testing should be considered in adults with overweight or obesity who have one or more of the following risk factors. First degree relative with prediabetes, high risk race or ethnicity, history of cardiovascular disease, hypertension, HDL cholesterol below 35 milligrams deciliter, and or a triglyceride level greater than 250 milligrams deciliter. Individuals with polycystic ovary syndrome, physical inactivity, and other clinical conditions associated with insulin resistance. Also, screening should be performed generally in people with prediabetes and in people who were diagnosed with gestational diabetes. Lifelong testing at least 3 years is recommended. For all people, testing should begin at age 35 years. If results are normal, testing should be repeated at a minimum of 3-year interval. In patients with HIV, it's important to perform screening before starting or changing antiretroviral treatment because they are immunosuppressed patients and must have strict metabolic control. The American Diabetes Association has recently published the following scale that defines whether a patient is at risk for type 2 diabetes mellitus, and it contains the criteria from the table above, but it's more accessible for patients and health professionals in primary care. Each patient can calculate the probability of having diabetes or prediabetes and take the result to the consultation with a family physician for the most appropriate intervention. The above tool therefore defines high or low risk for diabetes or prediabetes. Now, what is the indication of metformin in prediabetes? First, metformin mechanism of action is the reduction of hepatic glucose production by decreasing hepatic glycogenesis, and to a lesser extent, it also increases glucose uptake in the muscle cell. Talking about effectiveness, metformin reduces the glucated hemoglobin in 1.5 to 2%. Hypoglycemia is rare because this medication is euglycemic. About effects on weight, it reduces up to 5%. The most common adverse effects are gastrointestinal, diarrhea, bloating, B12 deficiency anemia, metallic taste, and lactic acidosis. Talking about the kidney profile, increased dose on the basis of glycemic control and tolerability if glomerular filtration rate is more than 45 milliliters minute. Then at increased dose if glomerular filtration rate is 30 to 45 milliliters minute, and if glomerular filtration rate falls, reduce the dose by 50%. Is contraindicated in glomerular filtration rate less than 30 milliliters minute. The maximum dose of metformin is 2,550 milligrams, but the full dose is 2,000 milligrams. As tips, start with low doses and increase weekly, and instruct the patient to take the medication with food to avoid gastrointestinal adverse effects and metallic taste. Finally, what is the best management for prediabetes? First, preventive management with lifestyle changes indicating patients to do physical exercise to reduce at least 7% of the weight with 150 weekly minutes of aerobic and muscular activity to activate the absorption of glucose in the blood to the muscle, besides counseling guided by a nutrition professional. The second measure is the use of metformin with an initial dose of 500 to 850 milligrams per day with increments toward the full dose. The metformin should be started in patients with between 25 to 59 years with a body mass index greater than 35, history of gestational diabetes mellitus, and glycated hemoglobin greater than 6%. The key to treat prediabetes is to individualize the patient and always ask what preference has regarding changes in lifestyle or drug treatment. Driving behaviors can be modified according to the results of the routine laboratory test. The following is the bibliography used to answer the question. Thank you so much. Thanks to Isabela Padilla Garcia, who performed the Spanish and Portuguese version of this video. Don't forget to subscribe, like the video, share it. See you in a new concise approach to internal medicine.